of weed patch, so just be advised.
Earlier this week, we told you about a study that found a link between women who are obese during pregnancy and their child's chances of having autism.
Today in studio, we have Dr. Jonathan Tarbox with the Autism Research Group to discuss this study a bit further and tell us exactly what this could mean. Doctor, thank you for coming in this morning and joining us. First of all, when it came out, there was a lot of concern and there, oh my goodness, finding a link. But you're saying it's not as dramatic as a link as that maybe some people have been led to believe.
Yeah, well, it is a 67% increase in your chance of having a child with autism if you are obese during pregnancy. And 67% sounds like a very large number, but given that the chance is pretty low anyways, you're going, it's still not really high probability that you're going to have a child with autism. So it's not anything to really sound the alarms about.
Does the study say anything about why obesity might be, even if it is a very small contributing factor, why that has to do anything with it?
Yeah, this study didn't directly investigate any of those possibilities, but some of the hypotheses are individuals who are obese have higher levels of inflammation in general and disordered levels of glucose. And so both of those factors possibly impact brain development in the fetus. So those are sort of hypotheses, but they require further research.
One of the numbers that has come out that's pretty solid right now, 1 in 88 kids have a chance of being born with autism. And once again, we can't say this enough, early detection vital. What are some warning signs? What are some things that parents should look for in their kids? And at what age?
I'm glad you asked that. Really as early as 1 year old, parents should be looking for their children to make some attempt at communicating, making eye contact with parents and other family members. Making some attempt at sharing their experiences with others. So if something interesting happens in the environment, you want your child looking at that and then looking at you. It's called joint attention. Basically an interest in social interaction. And if the baby wants to spend most of its time alone, is not responding to name when you call his or her name, those are potential reasons for concern.
Dr. Mike just mentioned that number, one out of every 88 kids has been diagnosed with autism. Does that mean that doctors are getting better at pinpointing the problem, or does it mean that more children are developing autism?
Most experts agree that it's probably some of both. So there is increased awareness, there is probably better quality diagnosis and increased access to diagnosis, but that can't explain all of it. So there is a very real increase, and quite frankly, we don't know why yet.
Okay, there are organizations that do a lot to help out, and a Valley Achievement Center is one of them. What are some of the training, and what are some of the things that parents should get active with when autism has been diagnosed?
Well, I'm glad you asked that, because the most important thing now is not to worry so much about obesity or things like that, but actually that there are proven treatments that actually work. So if you have a child diagnosed with autism today, there is something practical you can do about it. Applied behavior analysis is an intervention approach that has proven research, decades of research documenting its effectiveness. So if you have a child on the spectrum, you need to seek access to treatment right away, and there are very real gains that your child can make.
Dr. Tarbox, thanks for coming in. And I do want to mention this coming out, 7th Annual Valley Achievement Center Walk and Run fundraiser going on at Riverwalk Park, April 21st. For more information, you can contact Valley Achievement Center. Thank you for coming in this morning. We appreciate it.
No problem. Thanks a lot.
All right, it is 6.